Okay, so we're quickly trying to look at another aspect of hypertension. Okay, so we're trying to look at how hypertension can lead to a complication known as a hypertensive encephalopathy. That's like you have blood pressures, okay, going so high, so this could actually lead to some complications in the brain, you know. So anything you hear encephalon is actually the brain. So of course encephalopathy being a disease condition. All right, so what we have here is that hypertension could actually lead to hypertensive encephalopathy. Now this is when blood pressure rises so severely and rapidly that the brain's protective mechanisms, they kind of like fail. Okay, so this will now result into the brain swelling, and of course the activities of the brain are basically being scattered. So pathophysiology, how can high blood pressures actually lead to complications in the brain? Okay, so cerebral autoregulation breakdown. So normally the brain maintains a stable blood flow despite any fluctuation in your system. If there's any changes in your system, it doesn't actually affect the brain like that. The brain is always a chilled guy. Do you understand? The brain is always a chilled guy. So but in severe hypertension, that chillness is kind of like failing. Okay, so the result of excess cerebral blood flow leading to capillary leakage and vasogenic edema. So there can be fluid accumulation in the brain tissues. So blood-brain barrier disruption. So high blood pressures damage the endothelial cells, so this compromises the blood-brain barrier, allowing plasma and proteins to leak into the brain parenchyma. So the swelling increases what? Intracranial pressure, impairing neuronal function. The neurological symptoms emerge, so you're having all those issues like headache, nausea, confusion, So as pressure builds, patients may develop seizures, agitation, focal deficits, even comas could actually result. So why is it a medical emergency? So this hypertensive encephalopathy is actually part of a hypertensive emergency. Do you understand? Meaning it's like a complication in high blood pressure that you need like ASAP management and stuff. So of course the brain is a very precious organ, so you don't want any issues with it. So this is just trying to give a reason to why high blood pressures will actually lead to hypertensive encephalopathy.